Hi, my name's Jen Morrow. I got a PharmD and I'm on my last bit of being an MBA, and today I'd love to talk to you guys about how to open outpatient pharmacy and why here at Oswego Health. If Norman Rockwell painted a picture of rural healthcare, this is exactly what it would look like. Oswego Health Services is a small rural healthcare system in upstate New York. It provides an array of services over a very large geographical population. Most of the income is from program services, like most hospitals, and payroll is approximately one half of the expenses. To Oswego's health credit, the administration salaries are just a modest 1.6% of the entire budget, and that really shows the values that they hold here. But things like declining reimbursement, greater pressure to provide preventative treatment, and staffing shortages impact all healthcare systems. But these challenges threaten to overwhelm some rural healthcare facilities. Only 19.3% of the United States population is considered rural, yet it's 97% of the area. Like other rural health systems, Oswego Health has to bridge larger gaps for their population, including access to healthcare facilities, low healthcare IQ, and access to other needed services like transportation, social work, and health insurance coverage. Unlike urban health centers, Oswego does not serve a large diverse population, and it makes generating new income very, very difficult. So the first thing we're going to do is what's called a SWOT analysis. It's the strengths, weaknesses, opportunities, and threats. It's really clear from this analysis that Oswego Health has an unrealized strategic advantage in the community that they serve. They have excellent ties with the local governments and collaborate to find the best opportunities to improve the health of the population that they serve. The greatest weakness is they need to shore up dependable revenue streams. And the biggest opportunity is expansion of services so that their customers do not leave the area for care. This is shown actually previously. Oswego Health opened retirement community or assisted living, and that has been a great help to the community. The biggest threats are to prepare in the future for infectious diseases that are on the rise. A pestle analysis. This is the external analysis of what can impact Oswego Health. This really reveals that the economic impact of the pandemic was huge to Oswego, and secondary is the threat of ransomware, but otherwise very little is likely to change from any political, social, environmental, or legal issues in the next few years. VRR, or Vireo analysis, is an inward look at the organization. And in this case, it's really important to note that one of the biggest things you see at Oswego Health is that leadership is ready and capable of creating visions into reality. This can even go further if we support that leadership through the entire organization to help the associates adapt with those changes. So outpatient pharmacy. This is a really interesting opportunity for Oswego Health. Just got to remember that not all drugs come from pharmacies, and some of them may be your drugs of choice. But comprehensive pharmacy services, including outpatient retail, have the unique opportunity to provide a steady income for this entire health system. So now we're going to go through a complete analysis of how the outpatient pharmacy can be supported in Oswego's health system, and how it generates new, substantial, and the sustainable income streams. All right, so outpatient pharmacy is probably the next logical step. There's more past that, but you got to start with outpatient. And you might even see a chain pharmacy try to partner with a health system. The reason is because there's money in this, and it would be unwise of Oswego Health to give away that needed revenue. A small 300 prescription per day facility generates about $500,000 in billables for those 300 prescriptions. Most pharmacies run at approximately a 20% profit at this volume, but even if we calculate things conservatively at a 15% margin, means that retail pharmacy can add at least $11.5 million to the balance sheet yearly. One pharmacy may have a small impact, but it's very possible to open multiple pharmacies in very short periods of time, and that will have a greater impact on the bottom line. This furthers the goal to reach more of their geographical population and support the hospital system's greater mission through fund generation. The logical steps after adding outpatient pharmacy services is to expand into specialty and then transition of care. It's beyond the scope of this particular project, but just know there's more on the horizon. So listen close. This is the numbers. This is what you came for. A $300 prescription day facility generates $500,000. And here are those numbers if you transfer them out over 5 years. So you can see if we take our expenses, we're sitting somewhere around 81 to 82 million. And the biggest thing is that we notice that the building, or as you renovate or build, that changes, but over 5 years it actually has very, very small impact upon the bottom line. So how you implement that really doesn't matter too much. If you take that out over 5 years, it's $113,750,000 over 5 years, so almost $114 million. The return on investment in 5 years means $6 to $7 million per pharmacy added to the bottom line. And of course, if you fill more than 300 prescriptions per day, that goes up. So then we would want to add 340B. What is 340B? Legislation is introduced in 1990 that established governmental contract pricing for medications by qualified healthcare entities. So that can be used in the inpatient, outpatient, and specialty pharmacy settings of a healthcare system. So if you're not using that for inpatient yet, we definitely need to change that. And then if you add 340B to outpatient, it changes things greatly. That this 340B program can reduce drug costs by 30 to 50%. Considering cost of goods is almost 90% of everything that an outpatient pharmacy does, it nearly doubles the profitability of an outpatient facility. Just some quick rules, just so you know. If you want to qualify for a 340B program, which is not difficult, the health system must be enrolled and then registered. You recertify yearly. The records that identify 340B qualifying prescriptions must be kept for an audit in case there is one. 340B eligible prescriptions must be authorized by a provider within your health system. And the medication, whether it's inpatient or outpatient, you first purchase it at your average wholesale price, and then when you dispense it to a qualified patient or through a qualified prescription, then when you repurchase that medication to be back in your inventory, you buy it back at the 340B price. The proceeds from a 340B program must benefit the vulnerable populations within the health system directly or indirectly. And this is the gray area of this program and maybe some of the discussion that you've been hearing. Again, outside the scope of this particular project, but we can always talk about that later. So let's just revisit those numbers now. If you have 340B pricing, you can see that instead of $82 million in costs, we're looking at $50,000 in costs. And what does that mean? That means that over that same 5-year period, if you're looking 300 prescriptions, $114 million approximately in receipts, now you're adding $12 or $13 million to that bottom line per pharmacy. I couldn't resist. Now that we can see that adding outpatient pharmacy for Oswego Health has positive cash flow, there's even more perks that outpatient pharmacy provides. So let's start with readmission reduction, which I know is on everybody's plate. So this is just a really complicated diagram of all the things that lead to readmissions. And it's because readmissions are very complex, and there's never one program that will be able to solve all of these problems. Because patients are not the same and healthcare systems are not the same, that's why readmissions are very difficult problems to tackle. However, collecting data through pharmacy software, especially if it's integrated in the electronic medical record, is ideal for capturing the data of whether or not your patients are compliant. Are they taking the medication? Could they afford the medication? This data assists in medication therapy management and transition of care programs. Those both reduce admissions and specifically can also generate their own revenue to pay for those programs. Pharmacists often see the same patient multiple times per month. even when the patient only sees their primary care provider once every 6 months or a year. Because of this constant patient interaction, pharmacists are trusted with interventions and referral by the patients, and therefore can actually impact readmissions, not just as clinical pharmacists on the floor, helping patients stay in the hospital longer, get home sooner, but the outpatient portion is what keeps the patients at home and have them stop readmitting. Sorry, I still couldn't resist. So after readmissions, now, medication therapy, that adds billables. You get tons of interdepartment collaborations through falls prevention, cardiac rehab, the list goes on and on. On top of that, outpatient pharmacy that's within a health system has a higher sense of job satisfaction, and you retain your pharmacists. With your pharmacists on staff, the doctors now have a resource, so your outpatient or your family practice doctors have resources just like your hospitalists do, and that increases satisfaction for those providers. It's an amazing win-win situation. On top of that, we can provide immunizations. It's maybe the greatest opportunity to improve the health of the community by preventing illness. Vaccines have really low risks and high returns. If the pandemic has made one thing clear, it's that not gender or race drives vaccine hesitancy, but it's rurality. It's the fact that our rural population is the most vaccine hesitant in the US. So having pharmacists that are trusted and recommend and can deliver the immunizations right on the spot is critical for Oswego. Not to mention, immunizations have been offered by the chain pharmacies, not through the goodness of their heart. Though they are making bank on those immunizations, so don't throw away that money every year for flu season. And one of the other things that we don't talk about enough is how a transformative leadership style can really help your health system. So outpatient pharmacy is a perfect environment to foster female leadership. They are the ones who have developed collaborations and therefore have the transformative leadership style that will help move your business forward. Gender diverse executive teams experience greater organizational performance as well. These are qualities needed in our leadership to embrace an evidence-based approach to for the future of healthcare. Women in healthcare, though, often feel thwarted in their attempts to reach higher executive level positions, and that feeling is backed up with the percentage of female hospital CEOs has not really changed significantly in decades. 80% of our healthcare workforce is female, between nurses and doctors and our support staff. But if you get to the administrative wing, less than 20% of those females now hold administrative positions. So it's really important. And pharmacy currently houses about 75% female pharmacists and technicians. So it's pretty easy to see from the analyses, the SWOT, the PESTEL, and the Vireo, that Oswego has the unrealized strategic advantage in their geographical market. Outpatient pharmacy has so many benefits, and that, I mean, if you just want to look at the numbers, monetarily, it's kind of a no-brainer. But opening the outpatient facility, it can be done in less than a year. And that same pharmacy is very likely to be turning a profit within the second year of operation. At the minimal 300 RXs per day, you will add $11 million to your balance sheet. And these are really conservative figures. If instead of using 15%, you go to 20, the numbers are more like 13 or $14 million. So, and of course, any help with the 340B drug program, we can get that rolling. That makes a huge difference as well. Secondary factors of data capture, medication therapy management, transition to care, reduction of emissions, improved employee retention. Pretty soon, pharmacists are going to have collaborative agreements even in New York. We already have them in many other states. That's going to help with your provider shortage, help with those recruiting costs, outrageous recruiting costs for providers. And then increase that interdepartment collaboration, adding the immunization programs. Outpatient kind of does it all for you. And you have an amazing bank of really well-versed health professionals who have training through medical school ready at your disposal. We have a bunch of references, and if you have any questions, I'd love to stick around. Thanks.